Hello everyone, today I'm going to be showing you how to assess the range of motion of the proximal hamstrings by the active straight leg raise assessment. Some sport actions that involve the proximal hamstrings are going to be acceleration through the concentric activation of the proximal hamstrings and the eccentric contraction of the proximal hamstrings in the deceleration of the femur in sprinting. Range of motion through the proximal hamstrings is especially important in maximal speed sprinting, as when there is a limitation, typically the muscle tissue is the first to go when the body cannot deal with the forces being applied to the hamstrings. I want to take us back now to the beginning and talk about the setup for the test and some of the things that we do to ensure a valid assessment of range of motion. Now, obviously, for the setup, we're going to have the athlete lie on their back. You can see here I'm placing the outside of my foot on the outside of their foot. Now, this is going to limit the external rotation of the femur, which could potentially add degrees of freedom in the proximal hamstrings of the leg we are testing. Now, we are testing the proximal hamstring range of motion within the sagittal plane. So you can see here, I'm just checking to make sure that the leg we're going to be testing stays in that sagittal plane as best as we can. Now, if we pause it right here, we can see the first mistake that I've made as the practitioner of this assessment. If we look at the right femur of this athlete, we can see that it is elevated off the floor, which indicates a posterior pelvic tilt. Now, we know from this point on that this is not going to be a valid assessment of range of motion. However, it does give me valuable insight into the limitations in range of motion of the proximal hamstrings of this left leg. Now, if I were to do it again, I would have placed my left hand on the femur or the thigh of that right leg just to make sure that we stay in complete extension of that hip and not allow any posterior pelvic tilt here. So we can see a clear limitation in the range of motion of proximal hamstrings just by that little slight flexion of the knee. So a quick cue to fully extend the knee and drop that femur down a little bit less flexion is going to clear up that issue. Now, once we hit the end range of motion, we're going to line the goniometer up with the femur. Typically, if an athlete has bigger quads or bigger hamstrings, you want to go for the middle of that thigh, as any protrusion of the quads or the hamstrings could affect the level of the goniometer, therefore skewing the results. So we make sure that it's directly in line with the femur to get the most accurate result possible. Now, if we skip ahead here to the other leg, you can see again that there is slight flexion of that left hip or the non-testing leg. Again, this would indicate non-validity of the test. However, once again, it would give some good information as to the limitations and range of motion of this athlete. Once we have the assessments for both of the legs, we would go back and do the same test again, once on each side, and then take the average of those results and compare them to literature